Hello, I'm Alistair McCulloch. Welcome to this 4AT teaching session. The 4AT is designed to help us detect delirium quickly and easily in routine practice. It can be used by any practitioner who has a basic knowledge of delirium. No special training is needed. The 4AT is very well validated with similar levels of validation to the CAM, and it's in wide use in many clinical centres around the world. It is meant to be used at the front door, including the emergency department, also in transitions of care and around the time of surgery, pre and post operatively, and at any other time when delirium is suspected. More information, including some case examples, can be found on the website, and you can see the URL there. The 4AT is scored from 0 to 12, with a score of 4 or more indicating possible delirium. The 4AT has 4 items. 1. Alertness. 2. The AMT4, which is the abbreviated mental test 4. 3. Attention, which is months of the year backwards. And 4. Acute change and fluctuation. I'm going to go through each of these in turn now. Item 1 is alertness, and here the rater is asked to score whether the person is obviously drowsy or agitated or hyperactive, and an abnormal rating gives a score of 4. Item 2 is the abbreviated mental test 4, which is comprised of 4 orientation items as listed there. And the scoring is simple. No mistakes is 0, 1 mistake is 1, 2 or more mistakes, or if the patient is untestable, that is, they can't respond to the questions, gives a 2. Item 3 is the attention item, and it is the months of the year backwards test, and it is scored according to the index there, with 7 or more months correctly getting a 0. If the person starts but can't complete the test to 7 months, or if they just refuse but they are able to engage in talking to you, they get a 1, and if they're untestable, the score is 2. An important feature of the 4AT is that all patients can receive a score whether or not they're able to talk to you or not. So this UTA, or unable to assess rating, which sometimes appears in some cognitive tests, doesn't appear with the 4AT because, as you've seen in the last 2 items, where somebody is untestable, they are given a score of 2 on the AMT4 and a 2 on the months backwards test. Item 4 is the standard acute change or fluctuating course item, which is found in DSM-5 and so on. And as per the DSM-5 criteria, multiple possible sources of information can be used to inform this, including your own knowledge of the patient, an informant, the case notes, maybe the letter from the general practitioner or family practitioner. The patient may know themselves, and I do encourage questioning the patient around the psychotic features or delusions using these questions there, which can sometimes give you evidence informing this change item. Before I move on to the cases, I just want to point out that there's a free app available for Android and iOS from that URL on the slide here. Now I'd like to move on to the cases. The first case concerns a woman who had surgery 2 days ago, and there are no reports of change in her mental status from the nurses. Hello, my name is Dr. Shepherd.
Hello.
It's nice to meet you, Mrs. Black.
Nice to meet you.
I'm just going to ask you some questions to do with memory and thinking, if that's okay.
Okay.
Can I just start by asking you to tell me your full name and address?
Mary Black, 20 Savile Avenue.
Great. And can you tell me what age you are now?
I'm 60.
And what's your date of birth?
It's the 6th of May, 1961.
Great. And what's the name of this place?
The Royal Family of Edinburgh.
Fine. And what year is it now?
It's 2021.
And can you start at December and tell me the months of the year in backwards order?
December, November, October, September, August, July, June, May, April, March, February, January.
Great, thanks. The last thing I want to ask is that sometimes in hospital with the drugs we give or when people are not feeling well, people can have strange experiences like seeing things that aren't real, and I just wondered if anything like that had happened to you.
No, not at all.
And have you been concerned about anything or frightened at all?
No, everything's been fine.
Just the same as your normal self?
It's the same as normal.
That's great. Thanks very much.
Thank you.
So this is a normal 4AT with normal alertness, normal cognition, and no evidence of acute change, giving a score of 0 out of 12. The second case concerns a man admitted the day before with a fall, and there's information from the son stating that his dad was more confused than normal. Mr. Ali? Mr. Ali? Hello, sir. My name's Dr. Shepherd.
Hello.
It's good to meet you.
Yes.
I just wondered if I could ask you some questions to do with memory and thinking.
Yeah.
Can I start by just asking you to tell me your full name and address?
Muhammad Ali, 5 Buxton, Edinburgh.
Thank you. And what's your age?
It's 38.
And what's your date of birth?
It's 6th of November 1956.
And what's the name of this place?
It's the hospital, the Royal Infirmary of Edinburgh.
Okay. And what year is it now?
Oh, it's 1982.
Thank you. Now I'd like to ask you if you could start at December and tell me the months of the year in backwards order. Backwards from December.
December, November, September. I can't.
Thank you. Now sometimes in hospital with the drugs we give or when people are not feeling well, they can have strange experiences like seeing things that aren't real or shouldn't be there. Has that happened to you at all?
Oh yeah, that has been happening.
Oh.
So I've been seeing dogs and children just playing there.
And how long has that been happening for?
Oh, I don't know, a day or something like that.
Okay, has it happened today at all?
No, happened last night.
Okay. And did it make you feel frightened?
Oh yeah, I felt horrible. It wasn't right. I thought I was losing my mind.
Okay, I'm sorry to hear that. And how do you feel now? Do you feel you're getting back to normal?
A bit better, but something's not right. I know something's not right.
Okay, thank you. In this case, Mr. Ali is a little bit sleepy at the beginning, but he's easily aroused from sleep and remains alert throughout, so he gets a score of 0 for alertness. He makes 2 mistakes at the MT4, giving a score of 2. He makes a mistake on months backwards and gets a score of 1. And he gets a score of 4 on item 4 because there is clear evidence of change. The third case is an 88-year-old woman who's had a hip fracture and she's just been admitted and she's awaiting surgery. The husband says that she is normally independent and is able to go out shopping on her own.
Mrs. Wilson, it's Dr. White here. Hello, Mrs. Wilson? Can you hear me? Can you hear me, Mrs. Wilson? Hello? Can you open your eyes for me? Mrs. Wilson, can you open your eyes for me? That's good, very good. Can you lift this hand up for me, Mrs. Wilson? No? That's fine, I'll pop back later.
Mrs. Wilson is sleepy throughout, getting a score of 4 on item 1, and she is untestable on the AMT4 and months backwards, getting a score of 2 each for these, and there's clear evidence of acute change, shows a score of 4. This gives an overall 4AT score of 12 out of 12, indicating likely delirium. Thank you very much for listening. I'd now be happy to take any questions or comments.